2, 1, go.
Hi, I'm here to inform you and give an informative speech on what hospice care, what it is. Hospice is the ending of our life journey where we are able to still be in control and have dignity in those final stages. Death is coming at some point for all of us, and we either put our heads in the sand and hide, or we actually take control and accept death for what it is. My name is Crystal Ashley. I'm a registered nurse, been a nurse for 20 years. Recently, I have been certified in hospice about 7-8 months ago, and I have actually been working in the hospice field and taking care of these patients in their home. So I've become very informed about what hospice actually is. Hospice offers dignity, respect, and is a comfortable alternative to those last final days of life. In this informative speech, I'm going to educate you on the origin, the benefits of hospice, and when it is time to invoke hospice. Hospice actually goes back to medieval times. The word actually comes from the Latin word hospitality. So back in the day when the travelers were traveling, they would actually stop in these hospices and they would take shelter and be given meals and be taken care of for the night until they moved on. The co-founder of hospice, her name was Dr. Dame Cicely Saunders. She actually co-founded hospice in 1948. She introduced what is the specialized care of taking care of terminally ill patients. Her first hospice came, it was actually in London, and it was St. Christopher's Hospice. And then in 1963, Dr. Saunders was actually given a speech at Yale University and was teaching these medical students of the specialized care, which is known as hospice now. So then in 1974, the first hospice came to the United States and was actually in Bradford, Connecticut. Today, now in Ohio, we actually have 104 hospice care centers, and then there's 279 in-home care organizations that do hospice care, which is actually what I work for. Now we've discussed about the origin of hospice and a little bit of what hospice is. Let's go into more detail of what actually hospice is and what it can do. Hospice can be a treatment that is done in the home, or we can actually do hospice at a hospice care center. A lot of times we will bring in their own interdisciplinary team, which is a physical therapist, a registered nurse, an LPN, a home health aide. We also have massage therapist and chaplains and social worker. The thing with being in the home, the loved ones are able to be there 24/7. But this is the other thing. If we start seeing that the loved ones are being a little overwhelmed and it's just too much for them to take care of their loved one at the home, that's when we actually can transfer them to a hospice care center, and then the family is still able to come in and see that patient 24/7. It's like a home environment at these care centers. With the hospice also, the medications are paid for. So it goes under what is called hospice Medicare. So all the hospice medications for that patient's terminal illness is paid for. All the equipment that is needed in the home, the hospital bed, the walker, any dressing supplies, bedpans, bedside commodes, whatever the patient needs to make them comfortable at that end of life stages is also free of charge. So with everything that I've talked about, let's go into what the benefits are for hospice. It's actually been known that you live longer being on hospice because the patient isn't as stressed anymore. You know, they don't have to worry about who's going to take care of them and who's going to get the house and who's going to do this. You know, we kind of bring in this big interdisciplinary team in that we actually cover all aspects of the final stages of life. So the patient has less stress, which obviously helps them and actually helps them live a little bit longer. Also, the family is able to be there 24/7 and they don't have to leave. They can be there anytime. I go into patients' homes and they're right in the bed with the patient. It's totally fine. Don't kick them out. There's no visiting hours like there would be in a hospital. As far as all the nurses and the therapists and everybody that does go in the home, they actually have to have specialized, it's all specialized care. We actually all have to be certified in hospice care. And actually, according to the American Association of College of Nursing, Robert Wood Johnson Foundation in 1977, he actually stated that competencies are necessary for the nurse to provide high quality hospice care for the terminal ill patients. With this, then the care for the patient is actually increased than it is with a regular hospital admission. In the hospital, you have your call light, but there's, 20 million nurses, and, they're not as specialized as they would be, in home care hospice. Not a lot of them understand what hospice is. So, the patient doesn't get the one-on-one 24/7 care that you would do at home or in the hospice care center. Actually, also in Lynn 2000, it was noted that half of conscious patients not living in the hospital, but half conscious hospitalized patients actually have pain in the last days before their death. Hospice care, that does not happen. We make sure that the patient becomes as pain-free as possible with the medications that's provided through the hospice physicians. The other thing is that we do have the bereavement services. We have the social worker, we have a chaplain, so, when the family becomes overwhelmed, they need assistance, or they just need somebody just to go and talk to. We have the chaplain available on the religious aspects, and the social worker can bring in other people to give them relief, just to be able to give them a break. Now, we reviewed all what hospice stands for, their origin, and the benefits. The thing is now, when is it actually time to invoke hospice care? Some of the things that we look for is a terminal illness of a patient with, doctor states that is 6 months or less. That isn't always true, though. Some patients will outlive that, and that's fine. If a patient goes longer than 6 months and all of a sudden starts doing better, they actually go to a different regular medical care. And then down the road, if they need hospice care again, they can come back. Medicare will pay actually as long as you need hospice care. They do not revoke any benefits at all. It's all paid for. The other thing that we look at too is even if the patient is starting to have increased symptoms or increased pain, or their nutritional status is just not doing well, then it's kind of time to bring in hospice. Or sometimes the patient doesn't even want to go in the hospital no more. They're done with curative measures, and they just want to treat the symptoms and just be comfortable and be able to be at their home. And, they're done with going in the hospital and being poked and prodded. They just want to be home and have their symptoms managed. That's when it is time for the hospice. So, in conclusion, I just want to let you know, I'm hoping that I informed you regarding what the hospice benefits or the hospice care is, what the benefits are, and then when it is time, to bring in the hospice. Saying the word hospice is pretty scary, but, unless you really understand what hospice care is, it will definitely change your mind, and you'll understand more what it is. I do want to give you a quote, though, from The Tale of Dying by Doug Smith. There's a little poem in there. It's one of the books that I did read. It states, "In letting go, there is gain. In giving up, there is advancements. Do not practice controlling, but practice allowing." Thank you.